KwaZulu-Natal is one of the 9 provinces in South Africa. As much as it is beautiful, the culture and the people are still having to deal with a lot of challenges inherited from the apartheid regime. Poverty, crime, rape, HIV and TB, we're still dealing with those things.
What Zinhle does day in and day out is she works as an ARV counselor, and she does it in the area of the world with the highest prevalence of HIV infection and one of the places with the least resources available. So talk about taking on a challenge.
I met Zinhle at a hospice in Durban, and I was going there bringing some food to a hospice support group. And when I arrived, the whole group, some of them in wheelchairs, some of them in stretchers, others sitting in chairs, and there was this very thin woman in the back seat singing like an angel.
When she met me, I was straight from being in hospital with meningitis, which is a headache that usually gets to trouble people with end-stage AIDS.
In KwaZulu-Natal, every other person you look down the road, it's positive, negative, positive, negative. Every other adult walking down the street is HIV infected. The clinic here, pregnant women coming for antenatal services, 60% of them are infected. And of those, up to 30% without any intervention are going to deliver positive babies. We have 1,500 nurses trained that join the workforce here in the public health sector every year. 1,500. 2,000 nurses die from AIDS every year.
We have a huge shortage of human resources. There are not enough doctors, there are not enough nurses, there's not enough resources for basic care. You can imagine how impossible or difficult it is to roll out an ARV program to a system that is not working for basic things.
The good news is that medications are now available to treat HIV infection in the public sector in South Africa. The problem is that there still is not sufficient access to those medicines.
If they don't start the treatment as early, they are to wait in a long queue there for the doctors for about a month or 2. Some of them, they die before they even see the doctor for the first time to initiate the drugs.
Mrs. Thabethe helped me because I was taking so long. I think they said we're waiting for 3 weeks or 1 month to come to see the doctor.
We felt that there wasn't enough time because the CD4 count was going down and she was ill.
So how do you feel about Mama T?
She look at me. Every time she phoned me, she said I must drink pills. I like her so much.
Okay. Musukhala uzophila. Okay, uzophila. Musukhala.
We leave the challenges. We know the challenges of the systems we're working in. We need some sort of intervention, some sort of innovative intervention that can allow us to spread our wings.